I'm Ashley, and this is the video that coincides with my PowerPoint presentation titled Seasonal Influenza and Influenza Vaccine. On slide number 2, you will see that there is a hyperlink to the cdc.gov website. This is where all of the information in this video has been derived from, and you can also find additional information and resources on the cdc.gov website. So what is influenza? Influenza is the flu, and it is a virus that infects any part of the respiratory system. So this can include the nose, the mouth, the throat, and the lungs. The flu is highly contagious. Depending on the person it infects, it can cause mild to severe symptoms, and in some cases can even lead to death. Signs and symptoms of the flu include fever and/or chills, cough, sore throat, stuffy or runny nose, body aches, headaches, tiredness, and especially in children, it can cause vomiting and diarrhea. So how is the flu spread? When a person who is infected with the flu coughs, sneezes, or talks, saliva or droplets come out of the mouth and can land in the mouth, nose of other individuals, and it can be spread this way. It can also be spread when a person talks, coughs, or sneezes, and the saliva actually drops onto a surface, and then another individual comes along, touches the surface, and then before washing their hands, touches their mouth or their nose. So it's contacted through droplets. There are certain people who are more at risk for developing the flu and for developing more severe symptoms from the flu. And anyone can basically get the flu. Even people who are considered to be healthy can get the flu. But certain people are more at risk. And these people include pregnant women, people who have asthma, diabetes, chronic lung disease, and other chronic medical conditions, anyone who has a suppressed immune system, and people younger than 5 and older than age 65. So on slide 7, this one is specifically for caregivers of people in the at-risk group. If you are a caregiver for a person in the at-risk group, or you live with someone who is in the at-risk group, or if you are a worker in a healthcare setting, such as a nurse, a doctor, a patient care tech, you absolutely need to receive the flu vaccine. Because caring for these people on a daily basis, if you actually have the flu and you're working with these people before you know you have the flu, it can be spread to them and it can be potentially very dangerous for these people. Treatment. The best and easiest way to even treat the flu is to not get it in the first place. So the best thing to do is get the flu vaccine each and every year. And the reason you need to get it every year is because from year to year, the virus actually mutates and can change. There are medications to treat or help with the signs and symptoms of the flu. Antivirals such as Tamiflu can be given if the flu symptoms are caught very early on in the illness. If it's been a couple of days that you've been having symptoms, Tamiflu is not going to help with this at all. It's not going to cure the flu. It's not going to help you much. And these antivirals can be very expensive. Medications are given to treat the symptoms, such as Tylenol for fever. And then you should drink plenty of water to stay hydrated, especially if you are vomiting or if you have diarrhea. I have the flu, so now what do? You need to stay home. There is a possibility that you can infect someone else if you are around them. You can pass the flu to someone else one day before you even start to have symptoms and up to 5 to 7 days after becoming sick. And you need to drink and rest and make sure you get plenty of water and electrolytes. The vaccine causes antibodies to develop 2 weeks after receiving it. The antibodies provide protection against the virus found in the vaccine. There are different types of the vaccine, like listed in slide 12. There is the trivalent shots, and it protects against 2 of the influenza A viruses and 1 of the influenza B viruses. The virus is grown in eggs, so if you are allergic to eggs, this would not really be an option for you. And it is approved for people ages 6 months and older. There is an egg-free trivalent shot, and that is approved for people only 18 to 49 years of age. There is a high-dose trivalent shot, and that is approved for people 65 and older. There is also an intradermal trivalent shot, which is injected directly into the skin, and it has a smaller needle, which can cause a little less pain. But this is only approved for people 18 to 64 years of age. And then there is a quadrivalent shot, and it protects against 2 influenza A viruses and 2 influenza B viruses. A standard dose is given either by a shot or nasal spray. The nasal spray is approved for healthy people 2 to 49 years of age. Safety of the vaccine. The viruses that are found in the vaccine are either in the shot or nasally are either killed or do not contain virus particles, which means that you absolutely cannot get the flu from the influenza vaccine. Mild problems can be experienced, especially around the shot site, which can include redness, swelling, itching, soreness. It can also cause headaches, muscle aches, fever, sore throat, vomiting, cough, runny nose, and nausea. If problems do occur, they usually only last for a couple of days. And allergic reactions can occur, but they are very rare. If you do have any of these signs or symptoms or an allergic reaction after receiving the influenza vaccine, you are encouraged to go to the CDC website and report these.